Hello and welcome to Virtual Investor Conferences. On behalf of OTC Markets, we are very pleased you have joined us for our Life Science Investor Forum. Our next presentation of the day is from Accustem Sciences. Please note, you may submit questions for the presenter in the box to the left of the slides. You can also view a company's availability for a one-on-one meeting by clicking Book a Meeting in the top toolbar. At this point, I'm very pleased to welcome Wendy Blosser, Chief Executive Officer of Accustem Sciences, which trades on the OTCQB venture market under the symbol ACUT. Welcome, Wendy.
Thank you so much, Greg. I appreciate that introduction, and thanks to all of you for joining this presentation. I hope you find it valuable. Certainly, this presentation will contain forward-looking statements. They involve risks and uncertainties and assumptions, and although we believe these expectations reflected in these forward-looking statements are reasonable, we can't guarantee these future results or levels of activity. So let's jump directly into the presentation here, and allow me to give you just a quick company overview of Accustem. We are a clinical stage diagnostic firm that plans to improve outcomes for patients with cancer through proprietary tests that address important and today clinically unanswered questions for patients with cancer. And we definitely believe we're going to play a fundamental role in this high diagnostic area of cancer treatment. Our initial product to market will be the MSC lung test. It's really a critical need product for patients that are at high risk of developing lung cancer. It's a best-in-class product, a 24 microRNA product panel with a sizable market opportunity of $5.5 billion. Today, the U.S. Preventative Task Force recommends annual screening for lung cancer patients that have at least a 20-pack year history, which is essentially one pack of cigarettes over 20 years. They're a current smoker, and they're of the age range of 50 to 80 years of age. So it really is a good thing that guidelines have been implemented to try to diagnose lung cancer much early in the process, because its 5-year survival rate is quite low. We also have a cancer stemness program that we're going to discuss. I'll describe it to you shortly. The nice thing about this program is we have one product in breast cancer that's validated for patients that have to evaluate patients as to their risk of late breast cancer recurrence. So we'll talk about that test. And the nice thing about that testing is the biology is based upon tumor stemness, and we think this testing can translate into other tumor types beyond breast cancer. And really, we've taken a really nice very vigilant, maintaining capital-efficient business model. We're familiar with some of the more difficult environments, especially at the OTC for raising funds. But we are looking to maintain a capital-efficient business model to return investor return. So when we talk about Accustem to investors, we tend to speak to 3 buckets or areas of corporate focus. Our MSC lung test was developed and licensed from the INT in Milan. The INT is essentially a center that's very similar to the National Cancer Institute here in the United States. It's a very well-renowned institution, and we have in-licensed that product from the INT. We have solid patent approval with those products, and we're in good shape, currently approved in Europe, and we're pending in China, the US, and elsewhere. We also like to speak to this broader stemness program. This stemness program is going to pursue new areas of signal seeking, given we believe that this signal should be applicable to most tumor types, solid tumor types anyway, and we'll explain why that's the case a little bit later in this presentation. But our stem printer test is validated, and it will be it'd be the first product out of our stemness program to hit the market at Accustem. And in this case, we in-licensed this product from the European Institute of Oncology, which is a top breast cancer and research center, one of the top breast cancer centers in Europe. And then finally, I'd like to give you a quick understanding of our focus on operationalizing and executing as a corporation upon all of these efforts. It's why I brought some of the best candidates in the diagnostic industry, executives, to join me in bringing these products to market. You know, with Joe Flanagan and Jeff Fenster, we've got a very long history in cancer diagnostics, so I look forward to having those discussions with you. We really have been in cancer diagnostics for the meaningful portion of our entire careers, and we have good opportunity to collaborate with industry partners based upon our history in business development and activities in working for some of these companies that we find interesting. But I'll speak more about this corporate approach and style a little bit later in the presentation, but we have built a phenomenal leadership team with great experience and success in the diagnostic market. And so what this slide is designed to show you is really the mapping of the requirements to commercialize and achieve Medicare reimbursement coverage for our testing. So we're progressing really nice with the MSC lung test and are currently, as we announced in a press release just this week, transferring this asset into the United States from Milan in preparation for commercialization in the United States. You'll note that we included a column for level 1 evidence in this chart. I just want to note that both of these products, the MSC lung test and the stem printer test, have level 1 data, which is always looked upon much more favorably, be it a community practitioner, be it an academic MD. So we're very proud of this data, and it's a real differentiator in the marketplace as a gold standard for clinical decision making. It's honestly quite rare to see companies in the clinical phase have data that is prospective and randomized. I estimate that it's less than 5% of companies at a preclinical stage, and honestly, companies, even once they're on the market and generating revenue, I'd say only half have prospective randomized clinical trials. So we're very proud of our data. It will play well in the market with clinicians. The MSC lung test does have one competitor in the market that's commercially available today, but the company does not have level 1 data, and generally they have less data all told. So we should have a nice market advantage here. Now, the stem printer test is in the same stage as far as level of evidence as MSC lung. That said, where the level of evidence is for stem printer for women at high risk for recurrence of breast cancer, that is generally speaking an answered question in genomics breast cancer today. But that said, we believe and have some evidence to show that we can answer separate clinical questions. So we do have level 1 evidence for prognostic answers as to how a patient will do in early stage breast cancer. We have some data in silico work to show that we might be able to inform surgical or other treatment approaches for patients. So I'll share that information for you in more detail. But before I do that, I'd like to just give you some understanding of the size of this lung cancer opportunity, the challenges that we have in managing patients with a low-dose CT scan alone, and then how the MSC lung test performs and will be implemented into a patient's workflow. So of these 15 million patients that are eligible for low-dose CT scanning, it's important to note that only about 5% of them are getting screened today. It is truly early in this process. It's also important to remember, though, that a robust lung cancer screening programs are early adopters, still in development. We believe there will be significant uptakes of screening as we commercialize our testing. Institutions will begin implementing logistical programs to better help identify and capture and follow patients at high risk of lung cancer, and certainly we will provide assistance to that end as well. And this is important. MDs and patients need this. Of these 1.6 million nodules identified in the United States, it's good news. Greater than 90% of these are benign. Unfortunately, though, just using low-dose CT scanning alone provides an indeterminate result 80% of the time. That's expensive, incredibly stressful to patients, and frustrating to physicians, and leads to potentially over or under treatment or just lost patients to the system. So utilizing our blood-based test, our MSC blood-based test, in conjunction with low-dose CT scanning, we show a 99% negative predictive value. And that data is significant, and it's going to help to reduce unnecessary testing. Because as you look at this, we've described the 80% of the time that these results are an indeterminate. That said, 62% of the time, patients that receive a biopsy had a benign biopsy, and 17% of the time, worse off, patients that remained in surveillance had a malignant nodule. So, current lung cancer risk assessment has real risk of overtreatment and undertreatment in these patient populations. And as you'll see here, our data show that these programs will be much more effective using the MSC lung test, given low-dose CT scanning alone shows indeterminate results too often. So when we look at these data on how the MSC lung test performs when integrated with the low-dose CT scan, it actually performs quite well. This Kaplan-Meier curve on our left, you see the MSC test performance in both a CT positive and a CT negative population. And again, all of these patients are still considered high-risk patients given their smoking history. But what our tests show is that we stratify both a CT positive and a CT negative patient quite well for the likelihood of lung cancer, but the bulk of the benefit is in the CT positive population. Now, I just want to quickly mention as a side note, in the future, we do believe we will be developing this test to come ahead of a low-dose CT scan, and that it will be a better treatment algorithm for patients. But at the outset, we're going to start utilizing this test in combination with a low-dose CT scan. So when we further refine the population on the left Kaplan-Meier curve, you can look at the results to the right in our recent Lancet publication late last year. And what we did is we incorporated some serial testing. And what it showed is when we serial test these patients, we see a doubling in the accuracy of the test and further stratification of the patients. And we don't have our Journal of Clinical Oncology paper represented on this slide here. It was a ASCO highlighted paper, very well received. And that data showed that when you add the MSC lung test to a low-dose CT scan, we see a 5-fold reduction in false positives. So ultimately, the test will more accurately identify patients who have cancer, and just as importantly, those who don't have cancer, the result of which is the right patients are sent for biopsy, and we reduce the number of false positives that occur. So it's encouraging. We've been evaluated in over 5,000 patients. We have level 1 data, and we are published in top-tier journals. This test will do quite well on the market, and this is how it will be embedded into the process. So some nodules are found incidentally, some are found through lung screening programs. They run a risk score on these patients. As you know, for the 80% who are going to end up with a indeterminate result, the MSC lung test will follow, and then the patient can be either upshifted as high risk into the biopsy or surgical program, or downshifted into low-dose CT programs. So we're excited to get this started. You can see we have one product on the market already that identifies nodules at high risk. For malignancy, that test is called Notify, and it's offered by Biodesix. They're estimating that their revenue will be in the 80 to 85 million range this year. And this revenue represents a small portion of the market as these programs continue to develop. There's still a ton of runway on this. That 80 to 85 million is probably just over 1% of the market, to be honest with you. Now, the reimbursement rate is solid for this. The Biodesix is reimbursed at the $35.20 mark. As is typical with high-value diagnostics, we will draft off that pricing and believe that our pricing will also come in at the $35.20 mark. But we are quite bullish with our data and publications compared to other tests on the market. At the end of the day, we have more data, we have higher quality data, and that is going to be a notable differentiator in the marketplace. So what I'd like to do now is jump into our breast cancer stemness program. And I'd like to, importantly, share with you the unique approach that we're going to take to genomics in this space. And I think what that'll do is give you a better understanding of why we believe testing with the biology behind our stemness biology may inform surgical or other treatment approaches that will benefit the patient. So I've already described the stem printer test in an earlier slide as a 20-gene test that was designed to determine which early-stage breast cancer patients were likely to recur and thus need chemotherapy. And again, that's based off this 20-gene panel that's measuring tumor stemness. And I just want to say, this is not, stemness levels are not a new concept in cancer. It's very fundamental. It is well accepted by physicians that treat cancer patients, and it's been really studied well over 2 decades. I would estimate that there's probably going to be 5,000 publications this year on tumor stemness levels alone. And it's interesting to think that with this interest, all this interest and knowledge of the importance of stemness and the impact on a patient's outcome, which again is not just limited to one tumor type. We think there's a link to all solid tumors based upon these 2 decades of data. And so we believe, again, that the most aggressive approach is right for these patients. And why is that the case? The case is because you must know the levels of stemness in a patient's tumor, because what these data show is a primary rationale for disease recurrence or lack of response to radiation or chemotherapy is due to high stemness levels in a patient's tumor. So given they're going to have a limited response, that's why we believe we need aggressive surgical approaches to kill stem cells. So it's a great opportunity for us. In our discussions with key opinion leaders, they've made clear that they see utility in knowing which patients have high levels of stemness in their tumor. So what you're seeing here is our prognostic data for the stem printer testing. This is strong prognostic data for risk of recurrence. The stem printer data show that patients are 4 times more likely to suffer a distant recurrence versus a stem printer low-risk patient. And so these publications, by the way, in the Kaplan-Meier show not only that we're prognostic across 2 data sets, but the benefit of that is you can begin to get CMS or Medicare reimbursement once you have 2 publications of this quality. So we have met that threshold to begin that process. And honestly, what's most exciting about this trans-ATAC cohort on the right, this is a patient sample set that most genomic markers in breast cancer that evaluate who's likely to recur have been measured against. That includes Oncotype DX from Exact Sciences, who's by far the market leader in prognostic testing for chemotherapy. And what's exciting to us here is not only that it's a prospective randomized trial, is that we did outperform the market leader, Oncotype DX, who earns in the $650 million range to answer the question of who needs chemo following surgery and who will not require chemo following surgery. So to beat the market leader on the same patient sample set is meaningful, especially given we may be able to answer additional questions physicians don't have the answers to today in the workup of a patient with breast cancer. So again, while we're pleased with these prognostic results, We want to continue working to answer other treatment approaches, be it lymph node dissection, be it extent need of radiation and the value of that to the patient. And so Joe and Jeff have consistently been going to get voice of customers from clinicians, and the voice of customer is strong. Having this information would influence treatment decisions, and today they don't have the tool to determine the best surgical interventions. Because when you think about the journey of a breast cancer patient, there are a lot of clinical questions in this timeline that physicians and patients need to think about. Most companies, as you see here, play in this therapeutic section. Accustem, we can, but Myriad, Agendia, Exact, Hologic, Veracyte, lots of companies are working there. It's why we're not excited about that space. But you can see here, when it comes to the surgical space, we would be the only company offering unique answers in this space. And so when you look at guidelines supporting testing, so be it NCCN guidelines, there's certainly a lot of guidelines that clinicians follow for the continuum of care for patients. There's one notable section along the entire continuum of care for patients with breast cancer where there are no recommendations. And so given that, we are bullish that we can have a meaningful product that will provide value to clinicians and their patients. We also believe, frankly, that based upon the fact that there's a handful of companies here that are earning about $800 million to answer the same question on who requires a chemotherapeutic agent following surgery and who does not, would find us a very interesting company, given we will answer a separate clinical question up further in the continuum of care of the patient. We anticipate our reimbursement rate will be at the $3,873 mark, just as these other companies have. And so with each patient tested, these companies can generate 2 streams of revenue. And so we certainly have had some interest from organizations that are wanting to hear more about our stemness biology. We'll hear much more about that over time. So just give me a minute here to tell you a little bit about this leadership team. We've got Jeff Fenster as our Chief Scientific Officer. He's also Chief of Operations. We've got Joe Flanagan as our Chief Business Officer and Kieran Shaw as our CFO. We're an experienced, successful team, very long history in cancer diagnostics. We've launched many products, very brand new products. We've developed new products, but we've also had a reputation in the industry for relaunching products that really just weren't doing quite well in the industry and needed a relaunch, which is infinitely harder than launching a brand new product. So, having Joe, Jeff, and Kieran here with me is absolutely invaluable. Jeff really specifically brings Jeff and Joe both bring superior knowledge of the diagnostic landscape. And that's from diagnosis all the way through to treatment of a patient's breast cancer. And that's important. And that's just not through reading clinical data. They are living with KOLs. They have been working with these KOLs for years, and they know how important it is to be disciplined in this area, because even great products and even great companies fail because there's a lack of understanding of the positioning of products and what drives product uptake. So, we think we've got a great opportunity here. I hope you see that as the same, and I encourage you to schedule one-on-one calls with me for the opportunity to invest in Accustem. The opportunity with the MSC lung test is solid. We're very excited about this product. It's got a $5.5 billion market opportunity, and we think we'll have rapid uptake once we're on the market in 2026. This team is the right team to take this product to market as well. We've got broad experience and deep relationships in the industry. This stemness program, we've got one product that's ready to go, and we've got 2 decades worth of data that say that stemness levels in all solid tumors impact the tumor's response to various therapeutic approaches. If we can validate in breast cancer, we should be able to validate this test in other solid tumor types. And we have, for that reason, a very compelling product portfolio and future products in the pipeline. And the products that we have today are solidly patent protected, and our margins at the outset are going to be close to that 80% range, and they will grow with scale over time. So that is the end of my actual presentation. I want to thank you for your time and attention today. I'm going to be happy to answer any questions, and I'd certainly like to thank you and encourage you to schedule these one-on-one meetings. So I am going to come to questions here. Forgive me 1 minute. So the first question I see here is, what makes stem printer distinct from other breast cancer genomic tests, particularly for incoming surgical and radiation planning decisions? That goes back to what we're measuring in the biology of our test, right? So there's various ways these markers get to the ultimate answers across genomic tests as to who is likely to recur and who is not likely to recur. So given our testing is based upon tumor stemness levels, again, very well studied throughout the years, and what it shows is these are the bad actors in cancer. So how do we help these patients? And we believe, and again, we have some in silico work to show that when you get more aggressive surgically and consider the approach from a radiation standpoint, that we can have impact on patient care. And it's a very different approach versus just a prognostic test that says how a patient will do. Now, every test starts as a prognostic test. Not many go predictive. We believe this one can. So we have one with a lot of questions here. Thank you. And my screen's getting a little wonky. How does the MSC test 24 microRNA risk stratification improve the accuracy of lung malignancy prediction compared to standard low-dose CT screening alone? So this is where we're drawing blood for the patient, right? And again, and that's a very nice thing for the patient because they, you know, it's a simple blood draw. It's not a biopsy. Patients have some resistance to go in for scanning or additional testing, whereas with a blood draw, it's so much less invasive. This adds more information to a low-dose CT scan that's capturing, in most cases, very small nodules that grow slowly over time. So interrogating the genomics behind this testing, as we have in over 5,000 patients across multiple studies, we have discovered that what these results show is a significant improvement in a reduction in those 80% of cases that do not respond, or excuse me, that get in a result that doesn't determine whether they should be upshifted into biopsy or downshifted into active surveillance. I think I've got time for at least one other question. So how does Accustem's portfolio compare to competitors such as Biodesix, Myriad, Exact Sciences, and Agendia as far as testing capabilities and expected revenue? That's a great question. We're squarely in the space of these other companies. Some have a rather broad portfolio, and some have a more limited portfolio. If you look at Biodesix, they really focus on lung cancer. They have several products, but their blockbuster product, without question, is their Notify test for patients at high risk of lung cancer to be applied with a low-dose CT scan. So that's their only area of focus right now. Myriad has been struggling a bit. They have divested themselves of the EndoPredict product, so we haven't been watching that company quite as closely. Exact Sciences is a force to be reckoned with, a very large company. They've got the Oncotype DX test with $630 million in revenue with that testing. They do have some assets in place now around lung cancer testing, and so we anticipate having potential alignments with Exact Sciences throughout over time. And so I think that might create some interesting conversations over the years. And then Agendia is focused on breast cancer. They've got a very nice risk of recurrence test, as well as Blueprint with subtyping, and they're a prognostic test for chemosensitivity. So again, we're not going to compete with these companies. We are going to offer, with the exception of Biodesix, we will compete with Biodesix, but these other companies we will be approaching a different clinical question. So I am getting a note that it's time for me to wrap this presentation. I want to just thank you again for your time. And again, you'll have the ability to sign up for one-on-one meetings, and I hope you do. Thank you so much for your time and attention.